This is Dr.T.S. Subashini from the Department of Pharmacology, SRM Dental College, Ramapuram. Today we are going to see about the scientists who have been referred to as father of pharmacology. Jonathan Pereira was the first scientist who was given the title father of pharmacology. He contributed much to the field of pharmacology. In 1823, he published a synopsis of chemical composition that takes place in the preparation of London Pharmacopoeia. In 1834, he first gave an English translation for a pharmacopoeia. Then in 1826, he released a manual for the use of medical students. In 1827, he released a general table of atomic numbers with an introduction to atomic theory. In 1839, his major contribution was the elements of materia medica and therapeutics. Next is Johann Ernst Oswald Schmidberg. Oswald Schmidberg was referred to as father of modern pharmacology. In 1887, he joined the University of Strasbourg and developed the discipline of pharmacology in a medical environment. He was the first person who developed pharmacology as a separate discipline in the medical environment. He developed a lot of laboratories for animal experimentation. One of its major contributions is the study of depressant effect of alcohol in the central nervous system. So he just found out the depressant effect of alcohol acting on the highest centers of the brain first and finally dulling the medullary centers. He also isolated the muscarine from Amanita muscaria and studied the nature of its physiological action. He also found out the pharmacological behavior of autonomic nervous system. His other contributions are study of the effect of nicotine on the heart, the physiological action of digitalis glycosides. So there is a cardiac glycoside that was first used for the treatment of congestive heart failure. He also studied the chemical studies on mucoproteins and mucopolysaccharides. His experimental studies have been reported in more than 200 scientific papers. Along with Bernard Nayon and Edwin Klebs, he founded the Archive for Experimental Pathology and Pharmacology. Samuel Hahnemann, he is referred to as father of human pharmacology. He is the person who found out the homeopathy system of medicine. He is the actual founder of the homeopathy. In 1779, he obtained the degree of M.D. at Erlangen. He asserted the theory that likes are cured by likes. That means he just found out that if you are going to give a drug to a healthy individual, the drug will tend to produce certain symptoms. The same symptoms we can find out in a person who has been having a specific disease. So a same drug that causes certain symptoms can also be able to treat the same symptoms. That is, likes are cured by the likes. In 1796, he published scientific paper based on his likes are cured by likes principle. He translated William Cullen's lectures on the materia medica into the German version. In 1810, he just gave his major contribution, Organon of Rational Medicine. That is, in that he explained his principles of homeopathy. In 1811, his major contribution was Pure Pharmacology, so where he explained the systemic effects produced by systematically administered drug to healthy individuals. Last but not the least is the father of Indian pharmacology, Colonel Ramnath Chopra. So Ramnath Chopra, he was the main person in the development of experimental pharmacology in India. He worked under Dixon, who is the first professor of pharmacology in the University of Cambridge. Ramnath Chopra worked in the Indian Army, so that's why he is referred to as Colonel Ramnath Chopra. He worked in the Indian Army, that is East African Front, in the First World War and in Afghan War of 1990. In 1921, he was appointed as a first professor of pharmacology at Calcutta School of Tropical Medicine. Government of India issued a postal stamp on his 101st birth anniversary because of his great contributions to the field of medicine, particularly pharmacology. In 1907, he received his LRCP and MRCS from England. In 1908, he received his MB and BCH. In 1912, he received his MD from University of Cambridge. He was also MRCP and FRCS from the University and Royal College of Physician and Surgeon, London. He was the head of the Department of Pharmacology in the Calcutta Medical College. His main work was on the systemic study of indigenous drugs of India. Apart from this, his other contributions are antimony test for diagnosis of leishmaniasis and glossary of Indian medicinal plants, indigenous drugs of India and the medicinal and poisonous plants of India. So this is his major contribution. And his important work is on Ramapuram serpentina, that is the plant from which reserpine, the world's first antihypertensive drug, was obtained. He compiled the first Indian pharmacopoeia in the year 1955, comprising many indigenous drugs. In 1930, he became the member of Drug Enquiry Committee, and he standardized the drug manufacturing procedures, and he played a major role to curb drug adulteration. He was the main brain behind the formulation of Drug Act 1940. He headed the Regional Research Laboratory at Jammu. He was instrumental in the establishment of National Drug Research Institute at Lucknow, which is now referred to as CD, or a Central Drug Research Institute. Some of the honors received by Colonel Ramnath Chopra are Minto Gold Medal, Squibb Award, Kaisari Hind Gold Medal. He was knighted and received Barclay Medal of Asiatic Society. These are all the references for this e-content.